Seth, you can go ahead and start now.
Okay, thank you, Ellen. Hello, everyone. Thank you, everyone, for joining us today. My name is Seth Freeman. I'm president of 4C's SEIU 1973, a union representing over 4,000 community college faculty and staff across our 12 Connecticut community colleges. Our union is here today in partnership with AFT to talk about the importance of mental health services in our Connecticut community colleges. We have a series of speakers who are going to speak to the mental health needs of our students, how we've seen a decline in mental health services across the community colleges, and how there's a need to significantly expand mental health services to better support our students in our communities. Starting us off is Kayla Garner, a graduate of Gateway Community College.
Good morning, everybody. My name is Kayla Garner, and I'm a proud Gateway alumnus and current Husky at UConn, studying management and engineering for manufacturing. Originating from Georgia, I moved to Connecticut 3 years ago and started my whole life over at Gateway. Mental health advocacy has been my hobby while being an engineering student. My work with mental health lies in the creation of the Mental Health Advocacy Club, a student-led club at Gateway that promoted school services, local resources, and information on mental health. I was fortunate to lead the club as president for 2 years, and our favorite work was our Wednesday tabling event where we interacted with our campus body on a one-on-one student level, scientifically proven to be more effective to help students seek mental health help. I served my last year at Gateway as the president on the Student Government Association board, where we also ran a mental health event with Meg Hutchinson. And I also worked in the Counseling and Wellness Center as a work study student. The Counseling and Wellness Center has always been my place to cry when I failed the test and wanted to drop out of engineering, has been my place to help coach me through relationship issues, and has been my place to connect with some of the most sincerest counselors and individuals who have always wanted to see me shine and succeed. Without this core wraparound service, I wouldn't be standing here today with an associate degree and attending the greatest school in the state. Go Huskies. Personally, I juggle with PTSD and bipolar disorder, recently diagnosed in my hospitalization during my last finals week at Gateway. Prior to my hospitalization, I had actually reached out to Gateway asking for support the week before finals, but our school's wellness center was closed as we had no counselors left since March. I did not receive a support email until a week after finals had concluded. In some ways, I do feel the school had failed me in that moment, as the wellness center was always a place that I was able to go to for support. A proposed legislation to this crisis that not only myself, but many other students are facing is the implementation of a system call line for students. To suggest and implement a call line is offensive and embarrassing. We have a national suicide hotline number, 1-800-273-8255, or we can call Connecticut's helpline at 211. What we need is on-ground, in-person support. It is offensive to students to have funding for mental health services and for us to be paying for tuition and to be told that we cannot have a counselor until the next academic year, an ongoing problem I have seen my entire time on campus. Today, I call upon our legislators to help alleviate this crisis by putting pressure on the administrations of our great institutions to hire fully staffed counseling and wellness centers. One counselor per school is not enough. We need adequate mental health care, a prime example being UConn's Counseling and Wellness Center. I have seen the effects of one counselor for an entire school, and it is a burnt out individual who is going to flee the system after their contract is up. We need to properly support and engage our staff and to focus on retaining talent. Again, thank you for allowing me to speak today on such a dear and close to home topic. Thank you.
Thank you, Kayla. Our next speaker is Dr. Ruth Gonzalez, Director of the Office in Student and Community Life at Northwestern Community College.
Good morning, everyone. Thank you so much for having me today. And thank you, Kayla. I'm sorry to hear that you did not receive the support that you needed at the time you needed the most. I've been at Northwestern for over 2 decades, and I have worked in the office of first student development, and now I am coordinating the student and community life. And I feel proud here at Northwestern as we have addressed our students' needs. And we understand that our students are complex individuals and also need more than academic support. Mental health has been a topic that we've discussed over and over, and also addressing our students' needs have also been addressed. My hope is that with this partnership between CSU and Timely MD, that this will create the very much needed opportunity for dialogue, the opportunity to sit down and express the need, and also perhaps with data, we can use numbers to show the importance of mental health providers on campus. As many of us, we have limited ways of capturing that data. And I feel that while it is much better to have that one-on-one on campus, which we already know that having that relationship is what keeps our students at our institutions, and that the goal is to meet our students' needs so that they can be successful, not only academically, but also in their overall life goals. And for me, having a healthy community, it is very important because I live in the community that my campus is in. So if we are producing not only academically balanced, but also generally overall balanced students, then we have a thriving community. So my hope is that we take this opportunity to look at the need and have those very much needed conversations with the on-campus staff, because we are still here. We're not very many, but we are still on campus, and we are trying to provide the needs to our students as best we can. I work very, very closely with community resources. That's why I wanted to highlight the community piece, because I also understand that there is so much that we can do on campus, like, 24/7. We don't have that, that ability to provide our students with 24/7 resources, but working with the community centers, we can do that. So my hope is that we take this opportunity so that we can, moving forward as we become an integrated system, really have the need, meet the needs of our students on our campus, continuing to strengthen and develop personal relationships with our students. So let's take this opportunity to continue the dialogue and bring in the services that our students need in the right way. Thank you.
Thank you, Dr. Gonzalez. Our next speaker is Lisa Slade, Director of Counseling and Wellness at Housatonic Community College.
Good morning, everyone. My name is Lisa Slade, Director of Counseling and Wellness at Housatonic Community College. And when I saw the memo that came out that our Board of Regents had spent $659,223 of federal COVID relief funds on a partnership with Timely MD, I had very mixed feelings about that. And the first feeling that came up was how there was little or very little conversation with the existing mental health counselors in the community college system about who are already on the front line servicing the mental needs of our college students. There's very little conversation or dialogue about what we really needed in order to assist the mental needs of our students. And I was pretty disturbed by that. Because once again, we are on the front line, and what that means is we are experiencing the traumas of our students firsthand. We are experiencing students who are having housing insecurities and food insecurities, and are in little distress and crisis. And the sad part is we don't have what we need to service them. And that's the God's honest truth. And to put that type of investment in outsourcing a mental health program outside of our state, outside of our community, outside of our campuses, without securing and laying a strong foundation for the already existing counseling programs was disturbing. And one of the things that we have to understand, and this is just not a trend that is happening in the Connecticut community college and university system, that we're seeing an increase in mental health issues among our college students. This is something that's nationwide. And I understand the benefits of having Timely MD in place, but we need to strengthen our foundations, and there needs to be professional licensed mental health counselors on every community college campus in Connecticut, period. And one of the things that the International Association of Counseling Services Accreditation says is that there needs to be one professional counselor per every 1,000 to 1,500 students. And we don't have that right now. And which that means is we're not even in compliance with that. And not only does that not send a message that we are prioritizing mental health services for students, it sends the message that we're terribly understaffed, and that there are not enough competent professionals in place to really serve and meet the needs of our students. Let me tell you where I was and what I experienced last night. At 10 o'clock last night, I got a text message from a student saying that they wanted to kill themselves. And it was very, important that I stopped what I was doing to make sure that that student was safe, and that emergency medical care got to that student, but it was a process. So I'm trying to understand how a program like Timely MD could actually come in and handle a situation like that when they only offer like 30-minute sessions for students. And I'm just confused about why there hasn't been plans and policies in place to really assist each college campus in establishing and building safe, accessible, visible counseling centers, and because we have to accept that with the COVID pandemic, that we can't continue to do college the way we used to do college. It has changed. And we have to meet the changes head on, and to accept that we need to have counseling center departments that are fully staffed with competent professionals in place with the technology and the software that they need in order to ethically service our students. I'm sitting in an office where I don't even have software to do that is tied to the student database to adequately do case management services and to manage the students that are coming in. So I'm really disturbed, and I'm concerned about the inequity that having just telecounseling services or telehealth services in place at colleges and no actual person on the front line that students can actually visibly see. Because one of the reasons is because it doesn't take into consideration what it takes for a student to ask for help. There's already a large stigma associated on our campuses with mental health. And the way that we have to combat that stigma is with education. So it takes a lot for a student to even come and ask for help. And let's think about the challenges that the pandemic faced. One of the challenges was that students struggled with online classes and accessing classes remotely. Why? Because there were inequities in our internet bandwidth. Students didn't have Wi-Fi services, and yet we're still asking students to take care of their mental health needs online and through programs like telehealth. And what's going to happen is there's going to be a lot of students that are not going to get their needs met. And when students come to my counseling and wellness center here at Housatonic Community College, they don't come, you know, in a state where, you know, I want to get ahead of these mental health issues and these mental health symptoms I'm experiencing. No, they come to us and they're already in distress. Their coping skills have already been exhausted, and they're usually in a state of high level distress or crisis mode. And we spend more than 30 minutes with our students trying to either, you know, mitigate some form of stability or mobilization to a higher level of care. And it's important that we build relationships, not just with the campus community and our faculty members who are also on the front line, so they know how to recognize the symptoms of a student that is in distress. But it's also important that we reinforce our partnerships in our local communities first. Our partnerships with community health centers, our partnerships with the emergency rooms, our partnership with the police, who often are the ones who go and respond when we ask for wellness checks on students. We have to strengthen those relationships before we even think about expanding to incorporate outside services to be added resources. We have other pressing needs that are way more important that need to be handled first. Thank you.
Thank you, Lisa. And our last speaker is Senator Flexer, Vice Chair of the Higher Education Committee and representing the district with Quinebaug Valley Community College.
Good morning. Thank you, Seth, and thank you to Kayla, Ruth, and Lisa for speaking this morning. I'm glad to be here with all of you, and I'm glad to learn more about the situation with regard to mental health services at our community colleges. I think many of us, when we saw the announcement a few weeks ago, thought, oh, well, that's a great idea, enhanced services and mental health care for our students. But to discover in recent weeks that there is such a disconnect from these services being offered, that the professionals on the ground were not only not being consulted in creating this new system, which again, new avenues for students to reach out and get help when they need it, I think is a good thing, but to not do it in consultation with the professionals on the ground, and to do it at a time when the mental health services that are available to students in person are being greatly degraded is really terrible. I mean, I think Kayla spoke of her own individual story very powerfully. And we know that there are hundreds of students across the state who've had similar experiences, and that's only going to get worse. And I think that this issue is a symptom of the larger problem of the consolidation process that the community college system has been under for quite some time. This consolidation is leading for less on-campus direct services for students, and I've been saying this for years, taking the community out of our community colleges. It's the in-person professionals who will know what the local resources are for a student in crisis, for a student that needs help. And this telehealth model, again, is great for some students, but it's not going to know what's right in that student's backyard to get help in an immediate manner. Consolidation of our community college system is ruining the support networks that students have on their individual campuses, and this issue is just another example of that. And I would just close by saying the legislature has been very keenly focused on mental health issues, and particularly mental health for college students, and we've passed some important legislation over the last several years. But as a legislature, we cannot say that we care about the mental health of college students and listen to what we've heard here this morning and not do something to rein in this consolidation that's decimating the services that are actually available on each of the individual campuses. We've got to do better. Thank you.
Thank you, Senator Flexer. At this time, we would like to open up for any questions from anyone from the media who is here.
Hi, hello, can you guys hear me? This is Amanda Blanco from the Hartford Courant. Okay, great. So I just wanted to quickly check a few things, and I think some of our other media members will have a similar question. So which schools, or is there a list of schools that we know of that do not have a full-time licensed counselor at this time?
Amanda, that I can follow up with that specific information. I can, but I don't have the answer to that specific question right now. But I can follow up with that.
Okay, I appreciate it. And if we could just talk a little bit about, this is a little bit more general kind of take on that question. Would you say that all the community colleges right now are experiencing these staffing shortages in the wellness centers, or are they specific to particular schools?
I can probably chime in on that. Amanda, so I was the first officially hired mental health counselor in the Connecticut Community College system. I originally worked at Norwalk Community College, and then I transitioned as the director of the community college at Housatonic. And I know that for a long time, I was a solo counselor. It was just myself and at Norwalk and doing the work. And when I transferred to Housatonic, I did inherit a staff of one professional counselor and one part-time counselor. And but they were counselors who had strong academic advising backgrounds. And even though they had the credentials and the licensing, we had to work and there was a lots of training that was necessary to put in place to, to help them to be able to work with students who were having mental health issues. So there is, some schools are very different, and that's one of the challenges. And every school has a different need. Every school has a different population, and every school has a different mental health community. And there are vast differences. So we cannot afford to take a one-size-fits-all model, in meeting the mental health needs of every schools. But like I said earlier, I don't know if I mentioned this, but one of the things that when we talk about counseling ethics says is that there has to be one professional counselor per every 1,000 to 1,500 students. And we don't have that. We do not have that student to professional counselor ratio, especially at campuses that don't have counselors. And there's 10 community colleges in the system. And like I said, I was one of the first, and I can probably guesstimate that only half of the colleges have at least one person that handles mental health issues on the college campus. And it's not enough. We're drowning, literally. We're drowning as we see an increase of student needs and students who are seeking to access support. And one of the things that I didn't get a chance to mention, and then this is clearly what the research says. The research says that counseling centers support retention. And there was a huge push after the pandemic for enrollment and recruitment. And we had standards where we wanted to have at least 4,000 students enrolled in the community college system. And that's a wonderful plan. But the plan also has to include a plan how to keep those students enrolled and how to retain those students. Because when our students come to campus, they don't just bring their laptops and their books and their homework assignments. They bring their mental health issues. They bring their anxieties, they bring their depressions, they bring their traumas, they bring the damage from the COVID COVID-19 pandemic. They bring the housing insecurities. They bring their food insecurities with them. They bring all these disparities with them, including an inability to focus on school. So we could take an approach and just look at something as simple as a psychological concept of Maslow's hierarchy of needs. If our students don't have their basic needs met, food, housing, shelter, safety, how can we expect them to excel, and how can we support them as students? And that means we can't continue to look at college the way we've been looking at college. We can't, because the college experience has changed dramatically for students, and we need to have professional counselors in place to support them.
Mm-hmm. Thank you so much, Lisa. I really appreciate that. And then just one last bigger picture question here, and I'll hand it off to somebody else. But I guess because obviously we're going to touch base with the administration too about this. And they're likely to say something along the lines of like, well, these services are going to reduce the burden load on a lot of our in-person counselors, et cetera, that kind of a thing. I guess in the future, do you ever see a role or a situation where this virtual component could coexist kind of peacefully with what's happening in person as a supplementary part of the overall system, or do you think that it's just ineffective overall?
Can I jump in again?
Sure.
Amanda, I think when you think about who is appropriate for telehealth, and one of the things that we know as professional counselors, everyone is not appropriate for telehealth. There's always, it's a wonderful way to gain access to mental health and medical services for our students, but at the same time, we have to take in consideration the inequities that exist in our community that will prevent students from accessing these services. And one of the things we know is that students of color, Black and Indigenous students of color, what impacts, the average student impacts them 10 times more. And if they're, struggling to manage internet bandwidth and things like that, and not even take into consideration the difficulties that people who have pre-existing mental health issues and traumas have being on camera itself, and talking to people who are strangers and don't necessarily look like them, and who don't come from communities that they come from, who don't understand the struggles, it's going to make them less likely to want to participate in that kind of program. And that's why we got to have people on campus who are trained, safe, culturally sensitive, culturally competent, clinical professionals who can work with these students who look like them, who live in the same communities as them, who understands the struggles that they are experiencing, and not some generic customer service counselor, who is not connected to the community campus at all.
Mm-hmm. Got it. Thank you so much. Yeah, so Seth, if you could just get us that list by, later on today, that would be immensely helpful.
Absolutely.
Thank
you. I'll do that, Amanda. And what I'll just add to provide more context is that through this consolidation process so far, the Board of Regents has already identified a model for many other functional areas of the college, advising, and for instance, they have yet to articulate the plan for mental health services in any clear way, or counseling period, to be frank. So right now on most of our community colleges, our counseling departments, which include mental health counseling, are understaffed. And this announcement of Timely MD was done before any comprehensive model showing how we would have, fully staffed counseling and wellness centers was announced. So it's not that there's a, just to speak to how this area it's kind of already been given like an afterthought, right? Because we're 4 years into this consolidation, and most of our counselors don't know what the role of counseling will be in this new college model, or what the role of mental health counseling will be. And that again speaks to a lack of input that our professionals have had in the process. So that's why that's the announcement of Timely MD in that context is even more concerning, right? In the context of a complete lack of a plan and lack of talking to the people, to our professionals on the ground. But to your question, yes, we'll find that out specifically.
Great. Thank you so much, guys.
Are there any other questions? Well, thank you very much to our speakers for taking the time, Senator Flexer, Lisa, Ruth, and Kayla. And thank you for everyone in the press who participated today. And we will follow up with more information as requested. Thank you, everyone.